Now, India went into Unlock 1.0 yesterday, which has seen more easing of restrictions. Now people can go to religious places once again. Shopping malls are open. Restaurants and hotels in several states are also open. And indeed, even in cities where there's been a huge spike in cases, life is now almost back to normal with many more people out on the roads. What does this mean at a time when India is also now reporting nearly 10,000 COVID cases in a day? Yesterday's figure stood at 9,983 as we wait for the Health Ministry to put out figures of the last 24 hours. No doubt this could well go above the 10,000 mark today. Now, what precautions do you have to take? Are we already in community transmission? What do these figures indicate? And how are medical experts who are at the forefront of the COVID battle now viewing this entire situation and how India needs to go forward from here? Joining us, Professor and Dr. Anup Kumar, who's head of Department of Urology, Robotics and Renal Transplants at the Safdarjung Hospital. We're also being joined by Dr. Piyush Ranjan, Additional Professor, Department of Medicine at the All India Institute of Medical Sciences. Dr. Piyush Ranjan, let me begin by asking you, now that India has gone into Unlock 1.0, where pretty much life is almost back to normal, barring a few exceptions, of course, with social distancing and mandatory precautions in place, are we at greater risk every time we step out, given that India is now looking at almost 10,000 cases every single day?
Yeah, as the numbers are larger now, so what you can presume that a larger number of people around you will now be infected. So with the every step that you take outside your house, so that definitely the risk is substantial and is increasing day by day. So you need to practice the social hygiene, social distancing and personal hygiene, the means for that more stringently, if you want to save yourself from getting infected. Yeah.
But let me put it like this, Professor Anup Kumar, was this the best time to go into unlockdown, as it were, when cases seem to be steadily rising? We've been hearing from experts, including the AIIMS director, that India is still very far away from its peak that could happen, in fact, even in September, some experts point out. So is this the best possible time to be opening everything up?
See, India started a lockdown very early, and this has been appreciated by all over the world as well as WHO. This gave us ample time to build up our resources, our infrastructure, and you have seen we have built a very good infrastructure in the last 3 months. Now, as our Honorable Prime Minister said, we have to go along with our economy also. You know, thousands and lakhs of the poor people, they're struggling to earn their money. And that's why it was very important to unlock the current situation. So I think this is the correct time, because if they would not have unopened this lockdown, the people would have started dying with the starvation. So I think this is the correct time. Only thing is, as Dr. Piyush said, now it is our responsibility. The citizens of the country, we have to follow all the rules, precautions. Number one, we have to build up our immunity. We have to help our government, and of course government is doing their best to trace the infection source and also to provide treatment to those who require treatment.
But Dr. Piyush Ranjan, the Delhi government, for instance, is saying that they're meeting today to decide on whether there is in fact community transmission or not. If we're looking at 10,000 cases a day, then in your opinion, are we not in community transmission already? And what kind of response or change in strategy can be done to address if indeed we are in community transmission?
Yeah, well, there are two parts of your question. The first part is, what is the stage of transmission that we are having? Community transmission, these are just a term to let you know how fast is the speed of transmission is actually. When you are not able to trace from where you are getting the infection, the primary source of infection, then probably you are in a community mode of transmission. Well, I don't want to raise the eyebrows, but I do think that we are already in a state of community transmission. People may disagree with me, but this is not important. What is important is that to understand this very fact that it's inevitable. As of now, our population is about 1/3 or even lesser than that of United States. And we are seeing United States is struggling with the number of cases, new cases that they are getting all through the time, for at least for the last 1 month or so. So I think the infection, whether we term it as community transmitter or not, is not important. What is important is that this is inevitable.
Okay.
As my former speaker has said that we need to open the economy, we need to step out from the house because the collateral damage is there.
Okay, fair enough. We take that point, and we've heard Professor Kumar make that point very eloquently. Very last question to you, Professor Kumar. We've just had the World Health Organization now say that the situation is worsening globally. Now is not the time to take the foot off the pedal. So obviously extra vigilance and all care needs to be taken. But the WHO has also now said that asymptomatic patients do not transmit the virus, or it's very rare for asymptomatic people to spread COVID-19. Your thoughts on that?
See, as we know, even in a country like India, we have close to 80% patients who are asymptomatic or mildly symptomatic. So this is an area of concern, and the asymptomatic or mild symptomatic patient, definitely they are the corona carriers, and they spread infection, because if they don't have symptoms and they come in contact with other person, the other person is just slightly less cautious as compared to those who are more symptomatic. So definitely WHO is working on this theory that whether they can spread the infection or not, but we have a lot of literature published till date from all across the world, and which have shown that asymptomatic carriers, they definitely spread infection. And even our own ICMR and Ministry of Health, they also cautioned that even if you are asymptomatic or mild symptomatic, you have to take all the precautions, isolate yourself,
Right.
you use a mask and use proper precautions, and do not come in contact with others. So this is a very important thing. I think we should all remember that this is a source of infection, and they have to stay apart from the others.